My name is Bethany Gladhill. My mother, Mary Lou Gladhill, was diagnosed with stage 4 colorectal cancer in the emergency room of United Hospital in July of 2004. She passed away on Christmas Day 2006, also at United Hospital. During the time, the 2.5 years that we still had her, my mother spent several stays in the hospital, and I have nothing but regard for the nurses, the doctors, the nursing assistants, and the staff that were there. Really, United felt like a second home to some extent, sad as that might be. The last time that she was in the hospital, that December, was a little bit different. She'd gone in on Tuesday. On Friday morning, I was a little bit later than I usually am. Normally, I would arrive around 5 o'clock, be there for the shift change of the nurses, be able to check the doctor at the beginning of his rounds, and continue through the day until I left at about 10 o'clock that night. I'd been there a little late the night before. We had a meeting with hospice that morning, so I got there probably a little after 6. We had a meeting with the hospice workers. Her doctor poked his head in on the beginning of his rounds. Said what I thought, that she seemed a little off that day. She seemed a little shaky. She wasn't quite responding. I kind of dealt with her a little bit, and then I realized that I'd been there for over 3 hours, that I hadn't met the nurse for that morning, that the whiteboard had not been changed from the nurse the night before, that I hadn't met the nurse's aide. At that point, I thought to stick my head outside to try to track down somebody. I hadn't seen her vitals for that morning yet, and I was pretty concerned. I found the nurse's aide. She came in and took the vitals. Before I knew it, the hospital room was filled. The rapid response team was there, a number of doctors, and I suddenly realized how risky the situation was when I found myself speaking to the hospital chaplain. My mother didn't pass away that day. It turned out later that she had vomited that morning, that she had aspirated that into her lungs, and that she had almost immediately, it appears, contracted pneumonia. I found out that the nurse that day was a traveling nurse, somebody that was brought in, didn't really understand the floor, didn't really have time to address things. It was a short-staffed floor that day. That nurse was sent home that day, and I didn't see that nurse for the rest of her time there. I don't believe he actually returned to the oncology ward. My mother never made it to the hospice that we spoke with. She never even made it to the hospice section of that unit. My mother passed away on Christmas Day, 2006. She never got to know her granddaughter. She never got to know she'd have a granddaughter. She might not have made it past those 10 days. As you in the healthcare profession know, we don't know how much time there is, no matter how good you all are. There are a lot of things you just don't know. That's okay, and I understand that. I have nothing but respect and awe for the work that healthcare professionals do every day. But every day, I can't help but think that if something had been different, if the nursing staff had been able to be in there a little bit more, the way that I saw it during so much of the rest of her stay, that she could have had a few more days, a few more weeks, maybe a year. She fought so hard. And I'd really give anything to have just a few more of those hours back.